Hello, welcome back. Today we are going to talk about another bacterium which is called Neisseria gonorrhoeae. This bacterium was discovered in 1879 by a physician called Ludwig Neisser. This bacterium is a gram-negative coffee bean-shaped bacterium, which is a Diplococcus, shifting from 0.6 to 1 diameter. This bacterium grows on chocolate agar dioxide, and it is responsible for a sexual disease called gonorrhea. Gonorrhea is the second most common sexual transmitted disease in the US, so it's really common. This bacterium multiplies in warm and moist areas because it's easy to grow. The bacterium is found in reproductive tract, essentially in the urine canal, in the cervix, so inside the reproductive organs in general. The bacterium can be transmitted during unprotected sex, oral sex, and when someone is infected, the bacteria can be easily spread by rubbing your eyes and from mothers to children. The symptoms for men begin from 2 to 14 days with a burning sensation while urinating, testicular swelling and or pain, and yellow, green and white discharge. And what about symptoms for women? The symptoms begin from 7 to 21 days with pain and burning sensation while urinating, spotting blood after sex, irregular bleeding period, and also yellow, green and white discharge. Who are at risk? Any sexually active person and people from 15 to 29 years old. It has appeared to be more common in women than men. Why are rates higher for women? Because they have serious complications from the infection. So pregnancy difficulties that usually end up in aborts, and they have pain and pelvic area and many inflammatory diseases. Of course, if the disease is not treated immediately, it can lead to health problems. For men, it will be difficult while urinating because the infection caused a scar on the urethra. For women, it will spread throughout the vaginal area, causing pelvic inflammatory disease. The treatment is represented by antibiotics. An important thing to say is that while under antibiotics, one must not have any extra sexual contact. You or anyone else must wait at least 7 days after medication, and both partners must be tested and treated, or else the infection will happen again. Because of the burning sensation while urinating, do you know how this disease was known in France? It was known la chaude pisse, that means hot piss. As many people say, safe sex is great sex, better wear a latex. Well, I don't know. I think that every kind of contact with other people may be dangerous for any kind of infection, because the mucosa you find in the reproductive system is the same mucosa you find inside your mouth, inside your nose. So just be careful, and the thing is that you don't have to be scared of contact, of course, but you have to be precautious, not only in order to protect yourself, but also to protect other people. So just get informed in order to know how to behave. So now let's change the matter. I would like to talk to you about another kind of bacterium which is called Chlamydia. Imagine that it is estimated that over 2 million Americans have chlamydia, but most of those who have it don't know it either. It is transmitted through contact with mucous membranes found in eyes, mouth, nose, vagina, rectum, urethra, so all kinds of mucous membranes, as I told you before. Only 25% of men have no symptoms, rather than 75% found in females. The symptoms associated with these kinds of infection which are transmitted with sexual contact, for example, have similar symptoms. So this is really difficult to understand which kind of microorganism we have inside the patient. The signs and symptoms in women in this case are vaginal discharge, burning and painful urination as always, abdominal or low back pain, nausea, fever, pain with intercourse, and vaginal bleeding between periods. Which are the signs and symptoms in men instead? Burning and painful urination, frequent urination, penile discharge, swollen and painful testicles, and if rectally, it's characterized by pain, discharge and bleeding. Which are the complications for women? Pelvic inflammatory disease, also known as PID, which is an infection of the uterus, ovaries and fallopian tubes. Other complications are infertility related to upper genital tract infection, causing permanent damage to fallopian tubes. And another complication is cervicitis, which is inflammation of the cervix. Which are the complications for men? Epididymitis, which is a painful inflammation of the tube system that is part of the testicles, which can lead to infertility. Urethritis, so inflammation of the urethra, and reactive arthritis. It is called Reiter's syndrome, which is an inflammation of joints, urethra and eyes. There are also complications during and after pregnancy. Some evidence suggests that it may lead to premature delivery, and after the pregnancy, babies may become infected in the respiratory tract or their eyes during the birthing process, because during the birthing process the newborns cross the genital tract where the bacterium stays normally. Which is the more common diagnostic testing? It is the antigen detection test. This test is the diagnostic test of choice for identifying chlamydial infection, although tissue cell cultures are more sensitive and more sensible. Then, newer nucleic acid probes using polymerase reaction are also commercially available nowadays. So there are different types of things that we can do for diagnosis. Cell tissue culture is obtained through aspiration. A sample of cells is collected and allowed to grow for about 48 to 72 hours, and a specific stain is used to detect chlamydia. Cell tissue cultures also allows for antimicrobial sensitivity testing, so it's very important to understand how the bacterium react to the exposure to the antimicrobial things, antimicrobial molecules and chemicals that we use for treatment. All sex partners should be evaluated, tested, treated, retested within 3 months after the initial infection. Women whose sex partners have not been appropriately treated are at high risk for reinfection, and consider that reinfections can increase risks of serious reproductive health complications. What we use for treatment? We usually use broad-spectrum antibiotics such as azithromycin and doxycycline. The first one has to be given in a single dose in 1 gram, while doxycycline has to be given for 7 days. and so specifically 100 milligrams per day. Both of them are able to bind with ribosomal subunit of bacteria and inhibit protein synthesis. Alternative regimens are, for example, erythromycin, levofloxacin, ofloxacin, and other antibiotics.